Well, let's talk now to Mark Adams, who is the Chief Executive of Community Integrated Care, a health and social care charity. It looks after thousands of people with a variety of conditions, from dementia, learning disabilities, mental health needs and so on. Thank you very much, Mark, for joining us today. I've already heard you speaking in very impassioned terms about your response to what the Prime Minister had to say on the care sector's handling of coronavirus. And you've said you think at best his words were clumsy and cowardly, and at worst, Mark?
Kafkaesque in terms of rewriting history, I guess.
So you think the government is trying to shift blame?
Well, I mean, the interview that you obviously heard earlier, I think the quote that I also used was from Orwell's 1984 novel, which basically said, who controls the past controls the future, and who controls the present controls the past. And I think what we saw yesterday was the attempt of the Prime Minister to slowly start to reinvent history, which is completely unfair and untrue and damning to the sector.
The people you work with in the care sector, what has their response been to this? How have they been affected by what the Prime Minister has said?
I mean, you've shown this morning examples of care homes who've been utterly selfless, leaving their families, putting their own health and lives at risk to care for our parents, grandparents, brothers and sisters. And that in reality is the social care sector. It's so often the Cinderella of the health and social care system. It's unregarded. It doesn't get the recognition or the reward for what it deserves. And yesterday and last night and this morning, the calls and the feedback from not just our own team, but from the sector as a whole, has just shown absolute dismay in what the Prime Minister said. You know, for arguably the most important person in the country to be utterly damning about a sector that's worked so hard is frankly awful.
Does the Prime Minister owe all of the people working in this sector an apology?
Not just an apology for yesterday's comment, but the way in which the whole crisis has been managed from the beginning to the end. You know, for them to talk about asymptomatic people potentially spreading the virus, it's fine if you're testing people. But we didn't actually start doing testing until late in May in social care environments, and even then only once. You know, you can catch the virus at any time. We need testing weekly, and if we could, twice weekly. So it just doesn't stack up. We're in a situation where we've been failed on PPE, we've been failed on funding, we've been failed on testing, and then we're suddenly having the blame shifted to us.